and support on specific strategies within the Exhale technical package. And we invited two of our lung health and advocacy experts to discuss some specific tactics in the X strategy and the E2, as we like to call it, or the environmental policy strategy. So I'm pleased to introduce Laura Kate Bender. She's our National Assistant Vice President for our Healthy Air campaign. So she's going to share lots of information around E2 specifically, and hopefully provide you some information about things that you can do in your community. And as well as Thomas Carr, our National Director for Policy here at the Lung Association, to talk through specific strategies around smoke-free housing. So we're super excited to have both Laura, Kate, and Thomas join us today. And of course, Jasmine Sturdivant, our National Manager for Asthma Programs, will be presenting a little bit about overall picture of our project and wrap up today's conversation with some easy strategy implementation tips. So this is our plan for today. We will give you an overview of our Asthma Friendly Environments project. We'll talk through some of the tactics like our briefing series, and then I'm going to share some information specifically around stock asthma medication implementation, which I think has come up for some folks. So I'll share some implementation tips with you, as well as we'll get into our asthma and air quality, implementing smoke-free housing, and again, wrapping up today's conversation with some implementation tips. We'd like to leave the last part of today's presentation to do a Q&A, so feel free to drop any questions you have into today's chat, and we will be happy to answer those questions for you. All right, well, let's jump right in. I'm going to turn today's presentation over to Jasmine to give you just a quick overview of the Asthma Friendly Environments project. So, Jasmine?
Thanks, Barbara. So as Barbara said, I'm going to give a brief overview of our project and kind of give you some snapshots of our project webpage on lung.org. Next slide, Barbara. So the purpose of our project is to improve asthma among high burden populations through a coordinated dissemination and evaluation of CDC's Exhale strategies across the United States and to develop a network of strategic community partners. So we have three overall goals of the project, and that is to increase implementation of the effective strategies in Exhale by engaging strategic community partners to disseminate messages and effective interventions, to increase the number of people that live, work, or go to school in asthma-friendly environments by providing training and technical assistance and resources, and to advance the overall C-CARE goals of preventing 500,000 hospitalizations and emergency department visits among children with asthma. So what are we exactly doing? Here is a screenshot of a portion of our webpage that where we break down each of the Excel strategies and the programs, resources, and tools that we have available um, to assist you with implementing the Excel strategies. Now, they are broken by the acronym Excel, and under each of you can toggle between the each of the letters in Excel to see um, the problem statement and our solution to it, as well as those programs that fit under each strategy, and also tools that fit underneath there as well. Next slide. So here's a snapshot of another portion of our page, which is a map of our partnerships. This map is not accurate to the list that I have displayed here. But as you can see, we have 10 partnerships currently. And when you go to the map on the page, you can click on the states. There will be in that blue color, the ALA blue color. And when you click on them, you can see a list of the partnerships in each state and how we are partnering with them under each specific Exhale strategy. So now I will give a overview of one of the resources that we developed in year one of our 5-year project, and it is called the Asthma Friendly Environments Briefing. And Barbara dropped the link to the briefing in the chat for you to access. Next slide. So the overall purpose of the briefing series is, well, one, it's a recorded series, a recorded presentation where we go over all of the Excel strategies and the programs and service, and we go into more detail than what's on the website that I talked about earlier in regards to the program and strategies that align with the Secure initiative and fall under the Excel strategies. And so we want you to learn more about these evidence-based programs, our initiatives, and resources so you can bring them to your community and to help you implement the Excel strategies in your project. So when you complete the series, you'll be able to recognize the 6 proven effective strategies, as well as understand our approach to the Excel strategies and access and use our evidence-based programs and resources and bring them to your community. On this slide, you can click on the link underneath the picture so you can learn more about the briefing series. It is free for you to take, so there's no cost behind that. And also, you can utilize the link that Barbara dropped in the chat. So I'm going to pass the presentation back over to Barbara to talk about stock asthma medication implementation.
Yeah. All right. So I would say this part of our presentation really falls under the L in the Exhale technical package, so linkages and coordination of care across settings. And I wanted to focus on 2 questions that often arise when we talk about stock asthma medication. One is around acquiring spacers for students, for schools, where stock albuterol is available, and ideas for helping school nurses and other healthcare providers obtain funds for stock inhalers. So I'm excited to say that we, through another funded project, we pulled together a group of experts in implementation of stock asthma medication in schools. So this group was comprised of researchers. We had representation from state asthma programs, like from Missouri and Georgia. We had school nurses, state advocacy staff, and other implementers in the state. And the purpose of this expert group was to develop some guidance for states and school districts on implementing stock medication in schools. So the 3 sort of primary outcomes of this group, we were focused on identifying challenges and pitfalls that schools and school districts are experiencing with implementation. We discussed strategies to overcome those barriers. And the whole idea was really to develop some resources that could help or provide guidance for states and communities. So these were the 5 key topic areas or common barriers that were identified by the group. So we have obtaining standing orders, medication and devices, which I'm going to dive into a little bit today. Funding and sustainability of stock medication programs, training, standardized data and reporting. This includes documentation and follow-up. And then that whole implementation piece around sort of raising awareness of stock asthma medication in schools with the whole entire community. So as we looked at each of these common barriers, we did think about health equity and how this really impacts communities. I plan to do a webinar at the end of August to really get into the weeds on each of these topic areas. So it will be part of our Back to School with Asthma series focused on educating school personnel. So I will send around a link as soon as I have that available. I'll put it in the Asthma Talk listserv, so you guys can register and share that with your partners in the state. But I thought I'd spend just a little time talking about stock asthma medication and skills, specifically around obtaining funds for medication and supplies, because I think this is an area where we get most of our questions. I think it's important to remember whether you have a state law or not, schools and school districts can still choose to implement a stock medication policy. So just something to keep in mind. But I think what came out of this group, a key message or key takeaway I wanted to share today was that really sustaining your program over time, it's linked to the data that you're collecting and reporting, or really being able to show impact or effectiveness. So that's really important. So some of the conversation around obtaining funds, really understanding who in your school community has a diagnosis of asthma. So these are things you might need to know. Being able to assess EMS calls or who returns to the classroom are good to know. And some of the supplies that schools and school districts will need to think about for a stock albuterol program. You'll need a standing medical order or prescription. So that probably won't have a cost to you, but just something that you'll need to have. And that whole coordination piece does take time. So standing medical orders to obtain albuterol and valve holding chambers. And you'll want to do that for each school. Another part of that cost is the medication itself. So albuterol sulfate costs anywhere between $20 to $100 per inhaler, depending on how many doses it has and where you're obtaining the medication from. You'll need a supply of one-wave valve holding chambers. So I often get this question. Most schools or school districts will have 1 to 2 meter dose inhalers, but they're going to have a supply of valve holding chambers for each student. And you'll also want to think of things like alcohol wipes to clean the canister body and the nozzle. Other questions we get about this, can we have a nebulizer policy? And can we use nebulizers versus MDI with valve holding chambers? You can. So for schools and school districts that have nebulizers, we highly encourage schools and school districts to consider albuterol as an MDI inhaler with spacers, because they are portable and it does make it easier to use if you have to take it on field trips or to sporting events than to lug around a nebulizer. So that's something to think about. Schools and school districts, so you'll need to outline your costs. Program supplies, it's $85 or less typically for a stock inhaler and all the needed materials for schools. Its program expenses can vary based on your student enrollment, the school layout, and the community asthma prevalence. So really understanding the student body, how many students actually have asthma, or understanding asthma prevalence within your community. Schools with a large student body or sports program might want to consider purchasing additional stock inhalers to store in convenient locations, such as in the gym or near fields, near your sporting fields or whatever. So lastly, just to kind of wrap this up, sort of identifying funding sources, these or partnerships in the community that could really help. Understanding things like, do you have access to appropriations through your state law? Does the school health office have a budget? Do you need to make a presentation to the school board to outline the need for this in your school community in order to get that budget? Are there grant funds or foundation funds available? And then something else just to keep in mind, do you need to renew funding for each year? I have some examples here on the screen about potential organizations to consider obtaining supplies from. So think about your managed care organizations, your state Medicaid agencies, private health insurance companies, hospitals and emergency departments. Um, think about your not-for-profit hospitals who may need a community benefit you need to have a community benefit. This would be a great way for you guys to collaborate and work together. I'm going to share actually in our chat. I came across a couple of resources through our expert advisory group of some places where you can actually purchase albuterol online, as well as purchase those light air cardboard MDI holding chambers. So I'll put a couple of those links in the chat for you guys to take a look at. All right, and to wrap up this conversation, I just wanted to mention, in addition to the webinar that we're planning to host in August, we have a brand new course coming out called Stock Asthma Medication Implementation Guidance for Schools. It's a free 1-hour interactive online learning course. It's designed for licensed and unlicensed school personnel who administer stock quick relief asthma medication. And think about other stakeholders in your community seeking to understand and implement legislation, policies, and programs. The overall goal of that course is to develop, expand, and ensure compliance with a school's stock quick relief asthma medication program. So we have 4 learning modules to address the essential elements, such as understanding the need for asthma-related policies in schools, all the way to successfully implementing a robust stock asthma medication program. So our core course objectives, we have 6 overarching objectives. One being identifying the benefits of implementing a stock asthma medication program in your school, being able to develop and revise your policies to really protect students with asthma, recognizing and responding to someone experiencing respiratory distress, as well as administering stock quick relief medication. We get into topics of documenting and reporting the use of stock medication, and lastly, all of those implementation steps, how to obtain standing orders, your medication, other supplies. So a little bit of what I talked about today, also while addressing funding concerns, building awareness, and conducting evaluation. All right, so with that, I will see if folks have any questions. I'll invite you to go ahead and pop those into the chat. And I'm going to move our presentation along to talk about asthma and air quality. So I'm going to turn the presentation over to Laura Kate and take it away, Laura.
Thank you. Hi, everybody. Hope you're well. Thanks so much for having me on the line with you today. I'm Laura Kate Bender, National Assistant Vice President for Healthy Air at the American Lung Association, and I work on clean air and climate change policy. Next slide, please. So I'll do something a little bit different with my portion today. I'll take a step back and talk a little bit about the problem first, and then hone in on a couple potential solutions. So one, as we all know, air pollution is harmful to children and adults. Someone in every family, we like to say, is particularly at risk of additional health harm from unhealthy air, and that, of course, includes people with asthma. So you can see just some of the many ways here that outdoor air pollution can harm folks at large, and then, of course, people with asthma are at particular risk of experiencing exacerbations, ED visits, hospitalizations on days with unhealthy levels of air pollution. We also know that exposure over the long term, even to lower levels, is linked with long-term reduced lung function and other harm. Next slide, please. So 2 of the biggest, most widespread sources or types of air pollution that we focus on at the Lung Association are particle pollution or particulate matter and ozone pollution. And unfortunately, I think many of us may have been very personally familiar with these previously, but these last couple months, we have all gotten more familiar with them. So particles, as you probably know, the smaller they are, the more dangerous they are. So when we talk about particulate matter, we're often talking about PM 2.5, those tiny little green dots that are smaller than the width of a human hair. Those come from sources of combustion, so gas-powered cars, diesel-powered trucks, factories, industrial sources, and power plants, and from fires. And I think how I in the DC area and how many of you have likely been personally experiencing the impacts of unhealthy levels of particle pollution these last couple of months has been with the heavy dose of poor air quality that we've all gotten from the Canadian wildfires. Next slide, please. I also mentioned ozone pollution. The EPA moniker we always repeat is it's good up high, bad nearby. It's the same chemical as in the ozone layer, but when it's down near the ground, it is an air pollutant. It forms from emissions from vehicles, from power plants, and other sources, including some personal care products. And it creates what's often called smog. We like to liken it to a sunburn on your lungs. And many of us have been experiencing unhealthy levels of ozone too, because ozone forms in the presence of sunlight, and more heat often means more ozone. So we're really experiencing quite a summer with elevated levels of particles from the wildfire smoke and elevated levels of ozone in many places from the growing extreme heat. Next slide, please. So I wanted to just start quickly with how do you know how your local air quality is? Of course, you can use EPA's sources at airnow.gov. Highly recommend everyone check your daily air quality. As a person with asthma, I certainly do. But I also want to highlight for folks, in case you haven't seen it, the Lung Association's State of the Air report, available at lung.org/SOTA. We take the Environmental Protection Agency air quality data and we translate it in a way that's easy for the public to understand about how much pollution is in the air they're breathing. We actually give letter grades. So counties get a letter grade for their levels of ozone and for particle pollution. And then we also rank the most polluted and cleanest cities. We do this to help the public get a picture of what their local air quality is and what it means for their health. And it's always a resource that we're happy to point folks to, both to look at your own local levels, but then also to communicate to the public. Next slide, please. So let me quickly just tell you what we found. This is an annual report. State of the Air 2023 was our 24th annual report. So we're doing it for a while now. And what we found was that despite the air getting much cleaner over time, thanks to cleanup of things like automobiles and power plants and other industrial sources, there's still far too many people living with unhealthy air. We found nearly 120 million people lived in places that got Fs, lived with unhealthy levels of air pollution. It was fewer than last year's report, but unfortunately, there were two challenges to that. One is that not everybody is experiencing cleanup. And in fact, it'll look different in the coming reports because of the wildfire smoke that we've experienced on the East Coast this year. But what we found earlier this year in the 2023 report was that a lot of folks in the West are getting worse and worse doses of particle pollution, even as we clean up some of the industrial sources in the East. So there's this growing divide. We also know with regard to disparity, of course, that people of color are more likely to live near sources of air pollution, more likely to live in places with unhealthy air overall. And then the second challenge here is that despite all the great progress that the country has made toward cleanup, climate change is actually making air quality worse. Climate change is impacting the frequency of severe wildfires, the distribution of wildfire smoke, and extreme heat is making ozone pollution levels more likely. Next slide, please. So again, just to recap a couple of the top line findings, more than 1 in 3 Americans still live in places with unhealthy levels of air pollution, according to the report. Next slide. And I mentioned disparities. People of color are 3.7 times more likely than white people to live in a county that got failing grades across all 3 measures that we do in our report. So we do 2 grades for different types of particle pollution, 1 for ozone. And we found that people of color were more likely to live in a county that got any Fs, but much more likely to live in a county that got all 3 Fs. Next slide, please. So it's not all bad news. In the report, we also include recommendations. And so I'll pass along a couple of them here for folks' awareness. For individuals, we have a lot to say. We recommend that folks check their daily air quality forecasts. There's lots of things that individuals can do to reduce their own personal contributions to air pollution. To prioritize active transportation that doesn't pollute. Don't burn trash or leaves. Conserve electricity to avoid adding dirty power generation. And then we also highlight that there are new tax incentives in the Inflation Reduction Act that folks can use to purchase zero emission vehicles, purchase cleaner appliances for their homes. So there are lots of opportunities available there now too. And then, in terms of the recommendations that the Lung Association shares, lots of policy recommendations, but a few of interest for this group potentially are that states can adopt climate action plans. Cities and states can purchase zero emission vehicles for their own fleets. And purchase their power from renewable non-combustion sources, so clean electricity like solar or wind. And they can purchase zero-emission school buses in school districts, which I'll talk more about in just a second. So how can you use the report? Of course, you can look up your air quality. You can encourage others to look up their local air quality. One thing I'll also note is that we include populations at risk totals by county. So if it's a handy place to have an asthma total, we have you can pull the number of people that have asthma in places with Fs in your state, for example. We really use it to help individuals understand their risk from poor air quality and then help make the case for additional measures to reduce the sources of air pollution. Next slide. So one suggestion that we love for helping individuals understand their risk is getting more sites to participate in EPA's air quality flag program. So folks may already be familiar with this program. There's lots more information available from EPA at airnow.gov. But this is a program that EPA runs to help all types of sites, whether it's schools, daycare facilities, buildings, clubs, libraries, other organizations. They buy flags that correspond with the colors of the air quality index, and they fly the corresponding flag depending on what the air quality forecast is that day. So if it's a code red day for particles because of a wildfire, you would see a red flag flying out in front of that building. And there are corresponding actions. So for example, at my kids' schools, they play indoors instead of going out for recess on code red days. Next slide. Here's a map from EPA of all the sites nationwide that are participating in the air quality flag program. Again, it's a pretty low cost investment to buy some flags and a lot of opportunity to educate schools, community organizations, and other sites about what the air quality is in any given day, and then to make sure that they take corresponding action to protect health. Next slide. I also mentioned clean school buses. So I know the Excel strategies include cleaner diesel school buses, but the exciting news is that we now have an even better alternative. There are increasing numbers of zero emission electric school buses on the roads. EPA's new Clean School Bus Program, with funds passed into law in the last couple of years, is available to help schools get additional clean school buses on the road. Currently there are hundreds of thousands of school buses nationwide. The vast majority are diesel. Of course, we know that diesel exhaust is particularly harmful to kids with asthma. So switching to an alternative that now has no tailpipe pollution at all is a huge opportunity. Next slide. So I mentioned that the recent laws invested in this further. The Bipartisan Infrastructure Law, the Infrastructure Investment and Jobs Act, set up a program with $5 billion for EPA over 5 years to replace existing school buses with zero and low emission buses. There's a current opportunity open for competitive grant funding to fund bus replacement. Local or state governments, school districts, and other entities are eligible to apply, and I've put the link on this slide. Can drop it in the chat in a bit too, if that's helpful. And then finally, I'd be remiss if I didn't mention indoor air pollution. Of course, number one, harmful levels of outdoor pollution make their way indoors, impacting people with asthma. The Lung Association has resources, for example, at lung.org/wildfire for how folks with asthma can protect their health when there's lots of wildfire smoke outdoors. And then, of course, we know that we need to educate individuals about not adding to the burden of air pollution inside their homes with their appliances. So I mentioned that there are incentives available for individuals to swap to clean appliances that don't add to indoor air pollution. The link is there. And then, of course, things like opening a window when you cook on your stove. There are lots of measures that can help reduce indoor air pollutants beyond the great smoke-free work that we will talk about in just a moment. And with that, I will turn it over to Barbara.
Great. Thank you so much, Laura Kate. I hope that gave our listeners some ideas of ways that they can be implementing some strategies around E2 and outdoor air. And like Laura Kate said, I think the Lung Association's website has lots of resources and information to share with members in your community to get started. I started to put some of the, I got one of the links in there, Laura Kate. So if you want to add the lung.org, the wildfire information we have on lung.org. Oh, actually, I have the page open. I can do that. This is also, I think, a great resource, especially since we are in wildfire season. So thank you so much, Laura Kate. If there are questions for Laura Kate, I'd encourage folks to drop those into the chat. And we'd be happy to take questions right at the end of our presentation. But I'd like to introduce Thomas Carr, who's going to talk a little more about the X strategy in the Exhale technical package, specifically around some tactics on implementing smoke-free housing.
Great. Thanks, Barbara. Great to be here. Thomas Carr, National Director of Policy with the American Lung Association. So I'm going to talk a little bit about smoke-free housing and share some things about past things that people have done, and share things about past things that sorry, I got something else happening in just a moment. All right. So what's sorry, I got something happening with my phone. I don't know what's going on here, so I apologize.
I can hear you, so if that helps.
Okay. All right.
Or if it's distracting.
Yeah, that's the problem.
Yeah. You're getting
okay,
feedback.
There we go. Okay, I'm good now.
Okay.
Thank you. I'm sorry about that.
No problem.
Anyway, so just want to talk a little bit about smoke-free housing. I'll focus a lot on implementation of it, but I'm going to focus a lot on implementation of smoke-free housing, but I just wanted to share first about I want to share just a kind of a quick slide about how smoke travels through buildings. You can see here up to 65% of air in a building is shared in a multi-unit housing building. So if someone is smoking in an apartment in a multi-unit housing, it can easily travel to neighboring units. It happens through outlets, through vents, and the vents that are shared in common. It can happen through walls or other appliances as well too. So unfortunately, so it truly is a situation where if a person smokes in an apartment, their neighbors smoke too. Next slide. So just some major points to remember about smoke-free housing policies. If you're trying, and this is specifically if you're trying to implement one. One key to success is providing enough time between the announcement and implementation date for a new policy. This isn't something that you should be just be sprung on residents where you're trying to in buildings where you're trying to implement a policy. Giving people enough time to better understand and adjust to the policy will increase compliance and therefore make enforcement easier as well too. You should utilize every avenue you have to communicate and remind residents about the new smoke-free policy. Written, verbal, it doesn't matter because you can't communicate enough about this policy going into place. And also there's ways to involve residents as well too in the policy that can increase buy-in as well too. There are also lots of resources out there to help buildings implement their policies, provide smoking cessation to residents, otherwise make the policy a success. Next slide. So just a few tips on when beginning a smoke-free multi-unit housing effort in a community. When we're talking about strategic planning in this context, that would include identifying what types of multi-unit housing exist in your community and where they are located. In a lot of cases, it's going to be you're going to find that multi-unit housing is obviously more prevalent in cities than it is in smaller areas. So, next slide. Probably the biggest point I make on this slide is smoke-free multi-unit housing efforts don't just spring up on their own. It usually takes state and local health departments and / or public health advocates making a concerted effort in a state or community. That being said, once the groundwork is laid and the effort gets going, there's often a snowball effect, with many multi-unit housing properties wanting to go smoke-free all at the same time. Sometimes it can even be overwhelming. We've seen that we've definitely seen that in past projects. Next slide. There's a few key tactics you could implement as part of a smoke-free housing implementation campaign. We did lunch and learns in one of our past projects in Wichita, Kansas, for example. And these are aimed specifically at property owners and managers of multi-unit housing. And we basically in that project I was talking about, we did a series of 3 on various topics and then repeated it over again over the course of the campaign, which lasted probably about a year and a half or 2 years or so. You can join local apartment associations and organizations. One of the main goals of doing this is and exhibiting at trade shows is to collect names of individual properties and then follow up with them individually to further gauge their interest. Note that these organizations may only exist in bigger cities with more significant amounts of multi-unit housing, though. This is a tactic that I can't recommend more highly. Apartment owners and managers are more likely to listen to peer apartment owners and managers that have already gone smoke-free, who can credibly address and assuage their fears about making this change. This has been one of the most successful tactics we've used in smoke-free multi-unit housing campaigns I've been a part of. Next slide. So learning to speak the lingo. We certainly have lingo that we use in public health, as many people know. If you think about it, though, apartment owners and managers caring about different aspects of making multi-unit housing smoke-free makes complete sense. But it definitely behooves us to emphasize those points when talking with them. So things like reduce maintenance and turnover cost, reduce fire risk, increase marketability. These are all things that apartment owners and managers are going to care more about. You may also hear apartment owners and managers refer to smoke-free multi-unit housing as non-smoking policies. Slide. I'll focus on the two times to implement bullet on here. When lease renewal, you can do implementation when lease renewal occurs, which means when the smoke policy will be implemented on a rolling basis as lease renewal for tenants occurs, or you can do it on a set date. The Lung Association will usually recommend doing a set date to avoid confusion and make implementation and enforcement easier. But those are a couple of the options that you can certainly use. Next slide. So just while enforcement often brings the most concerns from apartment owners and managers, enforcing smoke-free multi-unit housing policies, like any other lease violation, is the safest route to take. Even in the absence, even generally speaking, that being said, there should be multiple violations before eviction is considered. That should be a last response. But one thing you may need to think about too is doing training for staff at the building or residence about how to enforce a policy, and there are options for that as well too. All right, next slide. So this is some resources that both about HUD, the HUD rule, which I know still comes up from time to time in places. On this slide, there's HUD itself is a pretty robust website page with resources on the rule, which is still maintained, including a smoke-free multi-unit housing resource bank that is linked from the website page on the slide. Note that there's a second project on here that is ended, but they definitely have still a treasure trove of information and resources that they are thankfully still maintaining. That's the smokefreepublichousingproject.org link. Then we have Lung Association resources as well too. At www.lung.org/smokefreehousing. These are both resources on smoke-free HUD, but also there are some general resources as well too. A couple that I'll mention are a fact sheet for residents that are experiencing secondhand smoke coming into their home, and kind of some steps they can take to do that, to ameliorate that. And then also there's a fact sheet on effective enforcement of smoke-free policies as well too, that goes over some of the things I talked about earlier. Next slide. So HUD rule enforcement. Individual public housing authorities set their own non-smoking policies and should be the first point of contact for violations that are occurring that you may hear about or are contacted about. HUD itself does offer advice to PHAs on their policies, and you can see some of that on this slide, including the image on the right there, and some of their guidance and a checklist. It's from a checklist that they created, that I linked to on this slide as well too. Next slide. So this is a common question I get a lot. How do I find more information on HUD properties in my community? Well, thankfully, the U.S. Department of Housing and Urban Development has an online resource. You can find gather information on PHAs in your state and community. You can click either on a state on a map. It's an interactive map, or use a drop-down menu that is on this page as well too, although it's not displayed here. When you'll see a column that says the type of housing, and that's low rent or combined, would be the type of housing that is affected by HUD smoke-free housing rule. Section 8 units are not, unfortunately. And there's also an address and contact information available for the individual PHA as well too. One note I'll make: there's no online list of all multi-unit housing in the community that I am aware of. Most communities that work on this issue have to develop a list themselves from various sources. That can be part of the strategic planning I mentioned earlier as well too. Next slide. So one simple action that states could take would be to coordinate with state tobacco control programs and the staff there. So those programs often manage or fund specific programs that seek to make multi-unit housing smoke-free, either across the state or in communities, where they fund someone to do so. I've included a link to contact information for state tobacco control programs in all 50 states here. So I know many folks may already be doing this. That's great, but certainly having the combined efforts of both the asthma program and the tobacco control program can be useful. So I just wanted to share that there. In general, I would say with smoke-free multi-unit housing policies, it really is it's about relationships and building them with stakeholders in the community, and making sure that talking with public housing authorities, they have things called resident councils as well too that you can talk with, that could be useful in terms of what they're seeing in their building and that kind of thing. There are community health centers that are often located near public housing authorities that could also be good venues to talk to. So there's a variety of different partners in the community that you could work with, and don't feel like you need to do smoke-free housing alone, and they could also provide resources to make it less or even not expensive at all. So I think with that, I will stop, but I'm happy to answer any questions.
Yeah, fantastic. Thank you so much, Thomas. I always learn a lot when I listen to you, and I think that sort of call to action for our state asthma programs about collaborating with your tobacco, the tobacco side of your health department is really a great one. Don't do it alone. You can always collaborate. So really appreciate that. Okay, any questions for Thomas, please go ahead and drop those in the chat. I see we do have some questions going, so we will get to those. We quickly wanted to run through some implementation tips, so I'm going to invite Jasmine back to talk through some of these.
Thanks, Barbara. I'm going to run through these last two slides really quick so we can answer some of the questions that are coming in. So although we didn't cover all the Excel strategies we just wanted to share some quick implementation tips to get you started. First, please feel free to visit our project page, lung.org/AFE, to review our different approaches, as well as complete the briefing series. For the first E, you can always promote asthma self-management education programs. With the and when partnering with the Lung Association, you can provide scholarships to train healthcare professionals or public health professionals to deliver our asthma self-management programs, Open Airways for School, Kicking Asthma, or Breathe Well, Live Well. As Thomas indicated, please coordinate with your state tobacco control programs who often run voluntary smoke-free housing programs in the state. Regarding the strategy H, promote and share resources about asthma triggers in your home. The Lung Association has an infographic called Controlling Air Pollutants in Multi-Unit Housing that you can share with residents and uh, and landlords in multi-unit housing as well. And strategy A, you can prepare a workforce of healthcare professionals by collaborating with us and providing scholarships for them to attend our Asthma Educator Institute and spirometry training. In regards to strategy L, feel free to promote our new stock asthma medication training to schools and members in your community. And lastly, the second E, you can share resources about the steps or actions people can take to protect their lung health during wildfire, smoke events, and extreme heat.
Fantastic. So yeah, just some quick little snapshots there of some tips.
As I just stated, you can get started by visiting our project page at lung.org/AFE or emailing us to our project inbox, afeinfo@lung.org. And we just ask that you complete this, which Barbara is going to drop in the chat, a quick evaluation about our presentation today so we can get some feedback on how this information has been useful to you. And now we can answer some questions that have been going in the chat, or if anyone wants to come off mute.
Yeah. And I'll just start with, in case people are not following along in the chat, there was a question about the registration link for the upcoming Back to School with Asthma webcast. It's forthcoming. I will post it to the Asthma Talk listserv. So be on the lookout for that. There was also a question about residential combustion. So thank you, Catherine Pruitt. She put a link in there for more information on lung, on our combustion, on the indoor combustion information. So please feel free to check that out. Okay, question for you, Thomas. I see in here, has legalization and increase in marijuana vaping impacted progress in enacting and enforcing smoke-free policies?
Yes, certainly it has. I think in terms of it does make, I think something we commonly hear, at least in the context of smoke-free multi-unit housing, is that if they don't have it's kind of, we keep hearing the idea that they need a place people need a place to smoke indoors, and so that has always been a challenge in terms of especially if they can't smoke in the in their residential unit, for example. So it is that has been a challenge that we've had to deal with, certainly. I don't know that it has really impacted smoke-free multi-unit housing a lot. I will say that with HUD housing, people aren't allowed to smoke anyway, just because or they're not supposed to be they're not supposed to, at least, because it's still marijuana is still illegal federally. So and HUD owned housing is federally yeah, so that applies to that, basically. So, but yes, it definitely can be a barrier in states, I will say, that have moved forward with this.
Great. Thank you. Thank you, Thomas. Let's see, anything else coming up in the chat? Something from Kelly, I see. I'd like to learn more about other state asthma programs, promoting Excel strategies in their home state, and how do you promote to providers, clinics, and systems? So I'll open that up to the group to see if there's, if folks have other responses for Kelly. And feel free to come off mute or put your answers right in the chat.
Hi, Barbara. This is Kelly Rods from Minnesota. I just wanted to add on to my question. I'm just really curious to know, like, communication and marketing strategies, or how other state programs are engaging with clinics and providers around the exhale strategies and the documents that CDC has provided on the website. So love to hear more about that. Maybe that can be covered today, but I can drop my email in the chat if anyone would want to reach out to me with what they're doing. So thank you.
Yeah.
Hi, Barbara. This is Pam. What they can also do is you can put it on Asthma Talk, as well as it could be one of the topics for your PI/PM calls when the states participate. Just in case you don't, get a reply, but I'm pretty sure a lot of recipients are thinking of that. So that's another way to get that information.
Great. Thanks, Pam. Great. Any other questions from the group? We can let you have a few minutes back in your day. Paige, any closing comments?
Sure, and if anybody has any last minute questions, feel free to raise your hand. But we are excited about this webinar series, and I'm so glad that all of you attended today. We did record for those that were unable to attend or that would like to view it again later or share with their partners. So we will be sending that out along with the slides from today's presentation, as well as the one that we had on Tuesday. So stay tuned for our next webinar series. It will be the third one, will be with the National Environmental Education Foundation on Tuesday, August the 1st at 2 p.m. And then we'll wrap up this summer sharing series with the Asthma and Allergy Foundation of America, and they'll be presenting on August 22nd at 2 p.m. So I don't see any other questions. Thank you all for your time, and I also encourage you all to check out our Excel guides. They do list a lot of this information from ALA and our other funded NGO partners in there and those resources. So take a look, and if you have any questions, feel free to reach out, and I'll be happy to help connect you with folks.
Yeah. Well, thank you, Paige, for the opportunity. I really, really appreciate it. And thanks to Thomas and Laura Kate for taking time out of your day to help us present this information today. So hope everyone stays cool. Take care, everyone.
Yes, definitely. All right. Thank you all. Bye-bye.
Bye.